I think he agrees.
Yeah.
All right, 9:30 now. It's an invisible disease caused by a tick bite. Tick bite, rather. Real Housewives of Beverly Hills star Yolanda Foster has been battling this disease now for years.
Yeah, but some have questioned just how sick she is. Now Foster, though, is speaking out with Dr. Oz. The doctor joins us live from New York this morning. Good morning, Dr. Oz.
Good morning. It's a big issue, not just for Yolanda, but there are many women across the country who have these sort of hidden ailments that they can't put a finger on. They don't have a clear diagnosis, and ultimately someone questions whether they're legitimate or not. So for the first time, Yolanda's agreed to speak out, in part to have her story understood better, but also serve as a role model for millions of other women.
So has she been diagnosed with Lyme disease? It just took a long time to discover that she actually has this disease?
Well, she was diagnosed initially with chronic fatigue syndrome, and she thought there was more to it than that. So she started traveling. She has the resources. She went to a dozen countries, saw more than 100 doctors, and in Europe they diagnosed her with having had chronic Lyme. Now remember, Lyme disease is caused by ticks. And when ticks bite you, they give you more than just one bacteria sometimes. So in her case, they think there was more than one bacteria. This becomes a fairly murky area because we don't understand how these bacteria work together. One expert I spoke to said that there might be a virus that we don't even know about yet that might have come along for the ride. It could explain a lot of the symptoms women have. But if you're feeling tired and washed out and sleeping doesn't help it, and you have headaches and joint pains, well, you know, what else is going on out there? And there's so many people who have these symptoms that we need to keep looking. In Yolanda's case, there were a couple of clues. She had a breast implant that had ruptured, so she had silicone all over the body. Those toxins could be important. She had mercury levels and mold. There were lots of things that were going on, but she's not alone. That's the case for a lot of women.
Now, how long can Lyme disease fester before you really start seeing any real symptoms? How long did it take Yolanda to start feeling sick and really go, okay, maybe there's a problem here?
The reason that this diagnosis is so hotly debated is no one knows the answer to that question. We know that soon after being bitten by a tick, you'll develop a bullseye rash in most cases. That's sort of red area around the bite, but you don't even notice it half the time. There's no massive symptoms most people have. And then in some cases, people start to develop bigger problems like the fogginess of the mind. You can actually get cardiac problems if the heart starts to get swollen. And so the chronic issues that go along with Lyme disease become hard because they're a chameleon. They sneak up on you in ways you didn't expect. Then there's this big debate about what happens after you treat Lyme. There's a post-treatment syndrome that seems to exist that also is problematic. And I'm not saying this all to confuse the issue, but the reality is there are so many people suffering from chronic ailments, probably along these lines in some cases, that writing them off as just being in their minds not fair. People have to search. And I'm hoping as we follow Yolanda's search for the cure, as she chases, in different countries with different doctors, she'll run into some bad guys and some good guys. And hopefully it will shed some light that people can become the world experts on their own bodies.
Okay. Also, we want to talk about this.